to the Homeless in America podcast, hosted by Metro Relief. We're diving into the deep end of homelessness and exploring ways you can help your community. Get ready for relevant stories from the streets with special guests and the leadership of Metro Relief.
Welcome, everybody. Thanks for joining us again on this Homeless in America podcast. Today we have an exciting guest with us from Baltimore. He's been all over the country. But just like normal, and we have, I always have Charlie with me, who I have a hard time saying his name.
Thank you for letting me attend another one.
Another one. Here we go. Just be careful.
Yes.
There's stuff around you.
I think Doug can, mute me if you need to.
Yeah, that's true.
Yeah.
Okay. And we, of course, we have Miss Wendy. Please welcome Miss Wendy.
Wendy is
That's
in the
mine.
house.
Yeah.
In the house.
Wendy is helping us host this podcast, and she's a great friend of mine. She works with the police
She's
department.
my friend, too.
I'm not talking about you. I'm
Oh,
talking
okay.
about Wendy.
It's not about
Well,
you,
you
Charlie.
got to circle me
It's
in.
not about you.
She does great. She's going to get the chance to talk a little bit about herself in one of these episodes, but please give her some patience as she gets used to hanging out with us two crazy guys. And Charlie, why don't you introduce our guest today?
Dan Stoltzfus. It's an honor to have you on this show, Dan. I was trying to think how to introduce you, and I just have to say that I admire you.
Yeah.
I admire what you've done with your life, your family, but the way you have put your nose down, put your head down, and done what you do, especially in Baltimore. I know that Hum is a efficient and great ministry because you're a part of it. I think that you're one of the smartest guys I ever met, and you still let me stay all night at your house when I come to Baltimore, and I haven't offended you yet. That's what's amazing.
Yeah, that's good.
That's good.
That's a good introduction.
It is.
Yeah, man, I'm in the guest room. It's usually ready for you guys when you come here.
But everybody, Dan is a nonprofit guru, and he started in New York, and now he's at a great place. It's called Helping Up Mission in Baltimore, Maryland. He'll tell us a little bit more about that. And then also Dan was a part of Metro Relief, helping them create Baltimore Relief.
Yeah.
Right? He's got the shirt on.
Oh yeah.
Representing.
So Dan, we're looking forward to this. Go ahead.
Yeah.
Awesome.
Well,
Thanks for coming, Dan.
I have.
Very kind.
Well,
humbling.
I think you
Yeah,
walked up the stairs and went into the bedroom. That's all right.
I've known.
Yeah, I don't know. I don't know if I've ever been introduced as a nonprofit guru, but I'll try to live up to
We
it.
can edit that out.
I've known
It's
Dan
okay.
for a long time. He's a
Yeah.
great guy, and he's probably responsible for the reason why we're even having a podcast called
Dan-
Homeless in America.
Dan met
today.
you when you were a young thug.
Yeah, he's like,
Dan knows where some dead bodies are.
we're not going to talk about that.
No?
No.
Oh, we're gonna stick on homeless.
That's a different episode.
We probably
Yeah.
need more time.
Yeah.
Yeah,
do.
that's a different episode.
But he's also responsible for me getting into this business. I mean,
Yeah.
of helping homeless people, and I just am grateful. So thank you, Dan, for that, and also thank you for joining
Privilege.
us. Yeah, of course.
Yeah, it's great to be with you. Thanks for the opportunity.
Yeah, and for you, I would love to know. I mean, all of us have a different reason why we do this, but for you, why do you help, and why do you still work in the arena of helping people off the street?
Yeah, that's a great question. I appreciate the opportunity to share. I mean, for me, it was an experience I had as a 19-year-old in New York City. And I'll just say that was several decades ago, but it was a while ago. I won't put a number on it, but you can probably figure it out. But I was 19 years old. It was the early 1990s in Brooklyn, specifically in the Bushwick section of Brooklyn. And I came from a background, my father was a pastor. I saw a lot of things growing up around seeing my folks minister to alcoholics and people in crisis and all that thing. But we lived in a small town in Western New York, and none of my upbringing really prepared me for what I saw on the streets in Brooklyn that day, which was essentially an open air drug market.
Yeah. What year was that?
This was 91.
Okay.
And there was guys, maybe 25 guys on the corner yelling out the street names of drugs, and people were, rolling by and going about their business. And it was just a very sort of jarring situation for me. And I was out with the New York City Relief Bus, right, which is kind of where sort of Austin and this ministry and I got started. But I was out on this bus. I was serving in New York because I was part of Youth of the Mission at the time. And just having this experience and trying to take it all in and say, I've never seen anything like this. I've never experienced this kind of reality on the street. We were feeding people. We were trying to get them connected to places like missions and treatment programs and everything in the city. And I was just there to serve, right? I mean, I was just a kid doing some community service. And I'll never forget, because I walked into the public park in Maria Hernandez Park, and I walked into the restroom in the park, the men's room, and there was a woman laying on the floor with a heroin needle sticking out of her arm, who was pretty sort of kind of emaciated. You guys have seen it, right?
Yeah.
With heroin addiction in particular, there's this sort of drawn, gaunt, look, and looking like, you're almost on death's door, which in a lot of places and situations you are, as I now know. And in that moment, I felt like God said to me, clearer than I've ever heard, this is what I want your life to be about.
Wow.
And it was in that moment as a 19-year-old that the entire trajectory of my life, the young woman that I met at the time, Angela, who's now my wife, who's journeyed with me since then, everything that we've done since then has been related to either homelessness, addiction, poverty, substance abuse prevention, something in that realm. Not because I had it all figured out and I had a pathway, but just because something changed for me in that moment. And I was learning, about Isaiah 58 and Matthew 25. And I was starting to get the understanding that actually this is an opportunity to worship God when we meet people in these circumstances and we share hope with them. It's actually, we're meeting Jesus and worshiping him. And so, everything since then has been connected to that. I don't feel naturally equipped by my background. I kind of feel like sometimes I'm a drunk who never had one. I mean, I don't really have this,
That's good.
I don't even have this sort of background in addiction. But
it's the heart of the Lord in you.
Right. When God breaks your heart over something, it changes the entire trajectory. I mean, I thought I was going to study computer science and I was going to do something. And ever since then, I've been in these kind of organizations, like where I currently am at Helping Out Mission. And it's been a crazy journey, and you wouldn't, kind of bounced all over the place, but that has been the constant theme. And I've had the opportunity to work with and see transformation happen on the street in people's lives. And along the way, God's given me some experiences, I guess, and some insight that I've been able to share with other people and other organizations. And it's an honor to be a part of it.
That's a pretty eye-opening experience as a young man. That's kind of, from your perspective, you walk into this bathroom and you haven't had a lot of lived experience of any of that.
See that? Yeah.
Yeah, that's crazy. It's crazy to experience that.
And I can see why that has stuck with you. If you were 19 then, it stuck with you for 4 years? You're about 25, 26?
Yeah. Well, just do the math. It was 91, so I'll let you figure that out.
But what is it that you actually do within the city to help those who identify as homeless?
Right. That's great. So I currently serve as the Chief Operating Officer at Helping Out Mission, which is we have 600 beds for addiction recovery and emergency shelter for men, about 500 beds for men, and currently 100 for women. We're on our way to filling out a 200-bed facility for women. And so, people sometimes get hung up on the title. I think in this kind of work, that that just means you do a lot of different things. I tell people chief operating officer basically means I mess with a lot of different things. I do facilities, I do IT, I do food deliveries, work with our program team, just a little bit of everything, which I love because just being a part of the work. And so we're primarily focused at Helping Up Mission on long-term addiction recovery programs. So we do operate some overnight shelter for people experiencing homelessness. We call it overnight guest services, which is about 50 beds, but the remainder of our beds are different types of programs that are all geared towards recovery. And where that connects to Baltimore is the stats we have about Baltimore is that 1 in 9 people in the city of Baltimore are experiencing addiction. So that's pretty startling number when you think about it in the city of 600,000.
Yeah.
That 1 in 9 people are, and we see that every day. People ask me if I watch The Wire, and I said, I don't have to watch The Wire. I live The Wire every day. I see it.
So
like, I don't, to be honest with you, I can't even watch it because it's so real and raw. And so, if I were to put sort of a theme on what we see with people experiencing homelessness in Baltimore, it's heavily influenced by addiction. Yeah. It's maybe different. I know everybody's battling that, but there's a higher level of it. And people say, well, why is it in Baltimore that you have such a challenge with it? I think part of it is we're a port city. Part of it was we're on I-95. I think a big part of it is there, unfortunately, is a culture, what I call a culture of despair, which we know leads people, right, to do things and try to medicate. And why is it a culture of despair in Baltimore? It's not just since Freddie Gray. It's there's long-term kind of corruption in the city that has influenced the ability to get resources here. When you have a city that's gone from 1 million to less than 600,000 in the last, 15, 20 years, that leads people to despair.
Well, the people
so
that can
what I get to do is
leave.
What's that?
Yeah.
The people that can leave, leaving the other people behind that can't leave, which is usually the people that are in poverty or.
That's right.
Yeah. So sorry about that. You mentioned 2 things, Dan. I wanted to just clarify for all of us. The Wire is a TV show that came out in the early 2000s, if you don't know about it.
Yeah.
It's one of the if people watch TV, it's one of the top 5 entertainment shows of the last couple decades. They really like it. They put it in with The Sopranos and Breaking Bad and The Wire. And it's about the rawness in Baltimore. It's also from someone who the guy that wrote The Wire wrote for the paper there, the Baltimore Sun, right?
Mm-hmm, mm-hmm.
So he lived it, then he wrote about it, and now Dan is living it, so he doesn't have to watch it. But if you want to see any realities of what's going on in Baltimore, watch The Wire. The other thing, Dan, you mentioned was Freddie Gray, and a lot of us would recognize that name. But if you didn't know, it happened in Baltimore, and it was kind of the start of an uprising before COVID, before they talked about Black Lives Matters. This was 2017?
15.
15. Okay.
16. Yeah.
16. Okay. So thanks for mentioning those. Dan, you're hitting on a lot of stuff here, so thank you for continually talking. 1 in 9 people.
Yeah, and so what we do at Helping Up Mission in particular, and then I'll connect to what we're trying to do with Baltimore Relief and that outreach collaboration, is we try to get people on a long-term path to recovery and transformation. We describe what we do as a community of hope, which is really important in a city paralyzed by despair in a lot of ways. And so we invite people into a community. We find that, a lot of addiction and people experiencing homelessness, one of the big issues, and I'm sure you see this in the Dallas metro area, it's isolation, right? It's disconnectedness. People are disconnected from their families. They're disconnected from social structures. They're disconnected from a pro-social kind of community. they're disconnected from God, you know, in so many ways. And so we're trying to really bridge that connection.
Yeah.
So what we're really focused on is getting people, not always homeless people coming into our program, but people battling addiction, and get them off the street and get them into a trajectory of life change, which the average person coming to a program has been in active addiction for over 20 years.
Wow.
The average age is in their mid 40s. So, you know, a 28-day program in that scenario probably is not going to do it.
Yeah.
Because you're trying to sort of rewire the brain, right? And pathways and choices. And so we find that, you know, creating a longer term recovery community is really important. So we have a 1-year spiritual recovery program. And then we have some other different accompanying programs that kind of go along with that. And then when people graduate from our program, they can continue to stay, be a part of the community, and continue to give back. And we find that strengthens the culture. 65% of the staff at Helping Up Mission are graduates of our program, which is a really powerful aspect of the culture, because they can look somebody coming in to our program in the eye and say, hey, I've been there. I've been where you are, and here's what happened to me, and here's how we can help you.
And that actually gives you credence, you know.
Well, it's also community.
Yeah.
Right.
But let me ask you this, Dan. What are the qualifications for someone to get into your program? I mean, what are the barriers?
Great question. Yeah. There really aren't a lot of qualifications. The biggest thing is a willingness to change. We don't have a cost structure in our program.
Way to go.
We're currently looking at, you know, one of the biggest barriers in the past has been folks that are on medication assisted treatment. And, you know, we're currently sort of revising our stance a little bit on that, because we want to be able to meet people where they're at. And increasingly that's people that are already on Suboxone or methadone or, you know, Subutex, some buprenorphine, some form of medication assisted treatment. So we're starting to find ways to kind of open the doors to that. In the past, we've just described ourselves as an abstinence-based program, and, you know, they have to be willing to change and commit to a new life. But it's pretty, you know, we don't take folks that have sexual offense backgrounds or something that would be, you know, dangerous to the community. We do have a lot of people that are coming out of incarceration. It's about 60% of our community. There are certain types of violent offenses, right, that might prohibit somebody from us being able to invite them in. But it's really it's a voluntary. They need to make a commitment to change, and so that kind of connects, Wendy, to, you know, what we're doing on the street now with Baltimore Relief, where we're partnering with Metro Relief and Why Went Baltimore and a group called Love Baltimore, to actually go out to the streets and find people in need and invite them to come in to resources and community. So whether that's, you know, an overnight guest bed, or as we've had people come out of encampments and you know, come off the streets right into our recovery program. We're trying to remove those barriers.
Yeah.
And I think in a lot of ways, the pandemic kind of created this, it's almost like it's like a hesitancy to come into a congregate kind of living environment, because there was so much narrative out there about, oh, well, we got to all be separate, and we got to all go out and be in separate hotel rooms. And I know you probably saw in some of your cities, you know, a lot of the federal resources at the city and state level were used to put people experiencing homelessness or battling addiction into individual hotel rooms. And our experience and what we've seen is that wasn't that effective for people.
Yeah.
Because they're more isolated. So whatever kind of negative behaviors were going on, or whatever despair, I mean, it wouldn't be a good situation for me. And I'm guessing it's not good for a lot of people to be in that kind of environment.
No,
and
not at
so
all. Yeah, because we've seen A lot of, the people that we come in contact who identify as homeless, they actually live in a community within a community.
Mm-hmm.
And to take someone out of that community, almost like their safety net,
Right.
their family, to take someone out of that environment and, like you said, literally isolate them, they go stir crazy.
Right.
Yeah.
I mean, addiction or no addiction.
Right.
It's
And
like
Charlie's-
moving to a new place. I mean, every time me and you move to a new place, we
Yeah.
acclimate,
Right.
and you're forcing somebody to move to a new place outside of a community that all things that they know.
Right. And they know, most of the people that we come in contact with, they feel, and we had said this just talking amongst each other earlier on, they've lost hope.
Yeah.
Right.
And then you put them in a room by themselves, with nothing.
Yeah, if they've got community out on the street and then you put them in a room all by themselves,
Yeah,
I
yeah.
mean, it's not going to.
It's not going to happen. And like you said, the average age is 45
Yeah.
or 40
Right.
something. And the
Right.
average time that they've been homeless is years. We're not talking
Right.
about months where they can remember how it used to
Right.
be. They've lost
Right.
that sense.
Yeah.
That's
so
right.
so to and correct me if I'm wrong. What you're saying is it's an individual treatment plan, for lack of a better word, there's no cookie cutter to your 1 year stay, because everyone that comes through, take away all the barriers or whatever, you have to address their issue personally, individually, because
That's right.
yeah, if a person has a headache, you don't take them to the foot doctor.
Right.
So you address their issues in order for them to succeed.
Right. And, in our environment, we're trying to do that in a holistic way with a lot of community partners because we can't do everything. And that's what, has motivated us to look at the Metro Relief model and others, because the need is so great that the only way it works is in partnership. So, for example, we have partners at Helping Out Mission that provide primary care. We have Greater Baltimore Medical Center that has a clinic that operates on our campus. And so they're providing primary care for the men and women that come into our community. We have a partnership with Johns Hopkins University where they have a accredited, CARF accredited clinic, mental health and substance use disorder clinic, that they deal with all the funding and the reimbursement and everything for insurance. It's offered free to our clients, but it's embedded into our program. So we try to use some of those resources plus a group of peer recovery coaches who work with us, who are graduates of our program, who are certified as peer recovery coaches, which is a growing, I'm sure you're seeing it's a growing field. And it makes a lot of sense because sometimes you don't need a clinician. Sometimes you need somebody who's been there.
Yeah.
Who can say, okay, this is what it looked like when I was in the throes of my addiction. This is how I get help. And now I'm going to, come alongside you and say, let me help you get there. So we have these peer recovery coaches who are graduates of our program who each have kind of a cohort of about 35 guys that they work with. And they're helping them on that journey. They're checking in with them. They're having the conversations where it's like, okay, you need to sit still for a minute. You need to learn to stick and stay. They're having that engagement with them. And so those are some of the critical aspects of our program. But we realized really coming out of the pandemic, because there was so much fear about being in these environments, and there was such a growth in, the overdose rates and the deaths by suicide and the mental health crisis and all these things, that a friend of mine described it this way, and I think it's a great way to describe it, that the epidemic of addiction actually T-boned the pandemic.
No.
Wow.
So, if you think about that, and unfortunately, my son and I were in an accident
At what
recently where we got T-boned. So I can kind of get my arms around that. And this car is coming across the street, 4 lanes of traffic, just cuts us off, spins us the other direction. Well, that's what's happening with addiction in Baltimore and other parts of the country. If you look at the overdose deaths, it's stunning, what's happened. And so, yeah, we got to deal with the pandemic. Hopefully we're coming out of that. But we realize we have to be much more aggressive in going to the streets, encouraging people to come in. I love what you've done there with building, trusting relationships being in the same place every Saturday, for example, and showing up and being there to catch somebody when they're ready.
Yeah.
Because I remember when I first started this kind of work, Austin probably has heard this spiel before. I was like, man, we're going out on the bus from 10 to 2. We got all these resources. There's people in need on the street. Like, we ought to be able to get this done by 2:00 this afternoon. Like, what's the issue?
How
right?
many weeks
Now
is this going
that
to
sounds
take?
like Dan right there.
There's
I
a
mean, I'm just like,
process.
what?
Yeah.
I mean,
Check
let's
it
get this
off.
done.
Yeah.
Check it off.
We
Some-
get 10
some-
people
but-
home this week,
Something you said.
100 by the end of the month.
Yeah.
We'll be
But I've
done by the end of the
realized
year.
that all of us, whatever situation we're in, when we need help, nobody can force us to the point of reaching out for help.
Yep.
Yeah.
Whether it's addiction or financial troubles, or you cannot force somebody to say, you know what, you need to get some help like right now.
Mm-hmm.
All of us, I think this is a common human thing. I don't think this is just unique to addiction, right? If we have a challenge going on, a situation, a crisis in our life, we have to get to the point where we say, you know what, I'm sick and tired of this. I got to get some help.
Mm-hmm.
Yeah. When you said to be there when they're ready, that's
Yeah.
key to Metro Relief. Because
Absolutely.
we got to be there when they're ready. So if we go
Right.
back every Saturday and every Friday to where we go, there's a guy we've taken to detox 3 times, and
Right.
he showed up at the bus on Friday because he knew we
Yeah.
would be there. We've taken him to detox 3 times in
Mhm.
6 weeks,
Mm-hmm.
and
Right.
and the staff and I were like, well, that's why we go to where we go.
Yeah.
He was ready again.
Right.
You know, I don't care how many times we have to take him.
Yeah.
Right.
That's a good point.
Yeah.
Thanks for sharing that, Dan. I
Yeah.
think the matter of being there when someone's ready. The hard part for me
Mhm.
though is like, why aren't you ready?
Oh my gosh, me too.
Well,
Yeah. Like,
Like
sometimes
you're on the street, bro. You should have.
Yeah.
What do you
ready a
mean
long
you're
time
not
ago.
ready? I
But
need
they-
another 24 hours. You're
yeah,
like,
but they
what?
can't even answer that question themselves.
Yeah.
Sometimes. I
Yeah.
mean, you're asking them a question that they don't even have the answer
That's
to
true.
that.
Yeah.
Yeah.
You know?
I think about.
Yeah, but I think that's why it's important that we put it in the human context, right?
Yes.
Think about a
Yeah.
situation with any of us where we're
Yeah.
facing a challenge, we're in crisis. There's a lot of times when I'm struggling with something that somebody's like, hey, can I help you? And I'm like, no, I don't want to deal with it.
Yeah.
I just need to figure this out, right?
Yeah.
Oh yeah.
Yeah.
If you put that understanding into people, experiencing homelessness or battling addiction, you can't force somebody to get help.
Oh,
No,
And that's what's
oh.
inspiring and
frustrating.
aggravating
Yeah.
about
At the
this
same
work all
time.
at the same
At
time.
the same
I
time.
think it goes against everything that we really have been taught to believe. I mean, you just said it about a process and trying to put people through it, and then it should work out eventually. It's the same thing with the way we were taught. You go do the right thing, and everything will end up all right.
Yeah.
It also reminds me of the parable of the workers.
Oh, yeah.
Matthew 20 was talking about all these workers, and they got the same. It's timing. Your timing's not always what their timing is.
Right,
You want
right.
it to be today, but it's not always
Right.
today.
Or the parable of just lost my train of thought. It was the sowers.
Mm,
No. The ones with the talents.
yeah.
Oh yeah.
One has 5, one has 2, one has 1.
Yeah.
Mhm.
Right. Even though I know what I should do with this, if I'm afraid, I'm gonna bury it.
Yeah.
And then when you come,
Yeah.
I'm gonna give you back. Well,
Yeah.
a lot of our friends that are homeless,
Right.
because they've lost hope, they just succumb.
Mhm.
Yeah.
Right.
It's like pushing a rope up, a wet rope uphill.
Yeah.
Oh yeah, that's an American saying. Good job. Give me some time with that.
Ah, nice.
I'm getting it right.
Is that sort of like
Yeah.
pushing spaghetti
is.
uphill?
Yeah.
Yeah.
I mean, it is.
Yeah.
If you find yourself, which sometimes happens, it's not that you grow up and say, ooh, when I'm 21, I want to be homeless.
Right.
Any situation, any incident, you find yourself
Yeah.
homeless. But how do you get out of it?
Yeah.
You don't even know how you got in it,
Right. That's
Mhm.
true. That's
you
true.
know? So,
Tell me something, Dan. What do you think about, and when you think about Baltimore, and if you could talk to somebody out in California, what is
Mhm.
different about people that are homeless in Baltimore than what we're dealing with out in California. At least I know you've been to Seattle. I know you know that place pretty well because of your daughters. So tell me what's different?
That's a really great question. So, I think it's a term that I've learned since I moved here 4 years ago is abandonminium.
Sorry,
So
it's not supposed to be funny.
we have
It's like a condominium.
over 10,000 abandoned row houses in Baltimore City.
Man, they're everywhere.
And literally, on my drive to work, I live in the city on the northeast side. I drive to the center of the city to get to work every day. I drive past probably 30 blocks that are all abandoned row houses. Wow. And so, when you do a point in time count, for example, or when you look at trying to engage people, unfortunately, there's a lot of people living in those abandoned row houses who
They're
are
not going in there and counting, are they? No.
Yeah. No. And so, I heard that term from some of our guys. I'm like, I was staying up in a bando. And I was like, what's a bando? And he's like, an abandonminium. And I'm like, what's a abandonminium?
Yeah.
It took me a little while to figure it out. But then I'm like, now that, when you drive past those row houses, and we've had, unfortunately, incidents where there's been, fires and people have died because they were living in a row house that wasn't safe, and they were maybe lighting up or something. And, the place caught fire, and we've had in the last year we had firefighters went into an unsafe abandonminium to battle a fire who were killed. So that's one thing that we don't have quite the open encampments. Our encampments here are a lot of those kind of people holed up in abandoned row houses. A lot of them are under bridges or highways. We do have some encampments, but there's been that's what's a little bit different. And there are resources, in the city for housing and shelter. I was just looking up some of the, numbers. I mean, right now our city, our point in time count was like 1,597, which seems pretty low. I think it's partially because people are undercounted, but there's also 480 people in particular who are still in hotel rooms as a result of funding from the pandemic.
Yeah.
Who would be experiencing homelessness. It's good. It's a good story from the standpoint of they're in a safer place.
1,500 people was on your pit count for the city of Baltimore?
Right.
Wow.
It seems a little low.
Yeah. Dan, Hum, Helping Up Mission, you guys work well with the city and the local government too, don't you? You have a good relationship and you go as far as you can and want to, right?
Well, I mean, we're not city funded. I mean, I think going through, I don't mean to bring everything back to the pandemic, but I think, Hum has been around since 1885. And as one of our staff, it made me chuckle when he described, we're like a 137-year-old man that's, learning how to adapt and change.
Yeah.
And so, and now we have a women's program. So I have to be, we're not just a man anymore. We're, we want to be more gender specific in our programming. And so we've had to change and be more flexible and agile coming through the pandemic. And I remember we're right across the street from the city health department.
Yeah.
So I remember when all those restrictions were coming down, right? I don't know if you guys had them there, but you can't have more than 50 people in a room and stuff like that. And then they boiled it down to 25. And it was like, I'm scratching my head going, how are we going to do this? So we got creative, right? And we live streamed classes and we spread people out at meals, but it's really hard to do in a community of 500, right?
Oh, yeah.
And so our census went down a little bit, so we were able to manage it. But I remember having a conversation with somebody from the health department who was like, you really should, keep people totally separate and deliver people meals in their rooms, in their beds. And I'm like, first of all, we don't have rooms. We have, a big dorm area with 30 guys in it. So delivering the meals so that everybody can eat them in their beds is probably not a good, strategy. And they're like, and you need to stop having meetings and chapel services and everything. And I remember looking at them saying, you know what? I respect that you're putting these rules in place, but our community is built on connection and relationship. we'll take all the precautions. We'll wear the masks. We'll do the, distancing. We'll do whatever we can. But at the bottom line, we got to keep people connected to each other, because I have a different problem if we don't.
Yeah.
In the community. And I asked them, I said, do you want me to put 400 people on the street? And they're like, no, don't do that. So I share that as an example, because now
that's the reality.
Yeah.
Yeah.
Now we've developed such a relationship and trust with them in terms of, they had, for example, an isolation hotel for COVID positives and everything that we would send people to. And we were always going back and forth and built a relationship. Well, those resources are gone to operate that hotel. But now the city health department is coming to us and say, can you operate an isolation dorm for people who are experiencing homelessness that the hospitals are getting, and they don't have anywhere to go now?
Wow.
And so we're like, sure, we can. We're set up to do that.
Yeah.
I have an intake dorm that's a negative pressure space. It's totally separated. It's got its own bathroom. It's got a separate entrance, and that's what we did. And the health department knew that. So I said, sure, if you want to send us, COVID positive people who are on the street, we'll handle it just like we did when we had positive cases that we used to put in there. So that's how I think we've tried to learn to work together and to partner. That particularly through the pandemic, those skills have been tested, and hopefully we've gotten better at that. And we're not quite like that 137-year-old person trying to figure out, kind of creaking around trying to figure out I don't know anybody who's 137 years old, so I don't know what that would look like. But I mean, I don't think you'd be really nimble and agile.
I think it's Benjamin Buttons.
Charlie, you're getting up there. What's it feel like?
He's close.
I'm sorry.
So let me ask you this one question then. If
Yeah.
someone came to you and said, I'd like to do something to help those who identify as homeless in the city of Baltimore, what would you suggest, or what would you offer to them of how they could help? Not necessarily you, how they can help that individual person.
So one of the things that we've done, this is really simple. It's not rocket science, but we've created these, cards, these kind of outreach cards with different resources on it. It talks about getting help and hope. And we've been encouraging, it has some helping on mission resources, but it also has some other places people can go. And we do have people that are at intersections and encounter people laying on the street. So one of the things that I've encouraged people to do, and it's a really simple thing, but take a bunch of these and take a bunch of granola bars, or one of our staff members who just joined our staff from our board, she's gotten a bunch of gift cards to the local convenience store, right? And it's a store that doesn't sell alcohol. And so, she gives out those gift cards, and just to treat people in a human way. So that's one thing, is to do that. I mean, obviously there's opportunities to get involved and serve at a place like Helping on Mission, putting together hygiene kits and socks and hats and those kind of things. We're also, now that we're starting this Baltimore Relief, outreach, we're going out on the street. We're up to 2 days a week. I don't know if we updated you on that,
Awesome.
Austin,
That
but
is
we're going out
really
on
cool.
Wednesdays and Thursdays.
Good.
Strong.
Wednesdays, we're going to a section called Brooklyn. It's not Brooklyn, New York. Although it's really ironic for me that my whole journey started in Brooklyn, New York.
Yeah.
And now we're in Brooklyn in Baltimore.
Yeah.
It's a neighborhood.
It's crazy.
And anyway, so we're out there on 5th Street in Patapsco. And then we have another location that's by a big methadone clinic called Turning Point Clinic that has about 2,500 people that come there every day.
That's the one. Yeah.
Yeah, we're at that corner.
2,500 people a day.
Oh my
come to
gosh,
one
that's-
clinic for
yeah.
The
methadone.
bus is still a little sick and needing some electrical
Yeah,
help, but
okay.
we're going out with vans and tables and chairs, kind of setting up like you all do. And we have our case managers on iPads, and just so, I think there's an opportunity for people to get involved, right? To volunteer and be a part of those kind of outreaches. But, I think more than anything, it's engaging that human interaction, stopping and saying, hey, what's your name? How can I help you today? And here's some information. you know, treating people in a human way and trying to understand the situation rather than, looking the other way or.
Well, you guys will be there when they're ready now.
Right.
That's 2 days a week. You're going to scoop people up and get them into
That's
a
our
program.
goal. Yep.
Yeah. I mean,
That's awesome.
sometimes that takes
And-
time.
And we've seen people come back, from encampments from the street and come right into our program. We
that's
had
great.
a young lady named LaShonda who came in, who her nickname is Bird, but she was living in an encampment out in Brooklyn, and she saw somebody get murdered out there.
Oh,
Who-
jeez.
And was living with a lot of trauma and had lost her boyfriend and was living out there as a woman in an encampment, not a very safe place to
Right.
be. And she came back, and to see the joy and, freedom in her life and kind of her go to a new place, was really encouraging.
That's cool.
And those are the kind of things that we want to facilitate. So, and now we have our vans wrapped, we have an ad about, our recovery program and experiencing hope, and, you have value and some of those kind of things on the side of the van, because when we just had the plain white vans, just driving around and asking people to get in our white van, it wasn't a good thing.
Did you also hand them a dum-dum sucker at the same time?
No.
Would you like to get in my van with a dum-dum sucker? Here you go.
So now we have these vans that are clearly helping up mission and clearly have a message of recovery
Awesome.
and hope.
Good.
And we're taking those out. And,
Especially
we've
if you
had a
were
lot of,
in the van by yourself. That would be weird. But
yeah.
how many vans? You said you're going with 2 vans and they're wrapped. One of the things
Right.
that you keep saying, Dan, is hope. You say that
Right.
Hum has a 1-year program called Community of Hope, or you're bringing people into the Community of Hope.
Right.
Keep talking about that piece of paper you just held up was hope.
Yeah.
I really think that's awesome, because we've been talking a lot around here about the despair and the people, the things that people feel. I mean, you were talking about it, Wendy.
Yeah.
People need hope.
Yeah.
We have to be dealers of hope. We have to find ways to instill hope. The scripture does that, I believe, just on its own.
Yeah.
And then there's ways that we do that. Go ahead, Dan.
And Austin, when you say that, it reminded me, I know you've heard me say this a lot of times, and I honestly, for a long time, just focused on this part of the verse, but in Proverbs, it talks about hope deferred makes the heart sick.
Oh, yeah.
Right. You've heard me quote that, right? And I always used to use that, to talk about, we can't give people bad information. Like we don't want to defer people's hope, but then I just realized this, and I'm like, how did I miss this part all these years? The second phrase of that verse is, but a longing fulfilled is a tree of life.
A longing fulfilled.
And
good.
so we've kind of started to adopt that in our Baltimore relief outreach. We've actually been talking about it. That's kind of our theme, right? Is we don't want to defer hope. We want to help people get on a path to see their longings fulfilled. Now, we don't have the tree of life in and of ourselves. That I think it's interesting that the scripture uses that language, because, that's one of the trees that was in the garden, right?
Sure was.
Yeah.
And I think a tree of life belongs only to God, but we're trying to introduce people to a tree of life, and that's the ultimate longing that we want to help them meet. But along the way, we want to help them get housed. We want to help them find community. We want to help them find recovery from addiction and all those things. But I was so focused for so many years on, we don't want to defer people hope. Make sure we don't give people bad information. And that's really important. But now I'm starting to really focus in my own heart and mind, and with our team, is like, but let's go fill some longings. Let's go help some people.
Oh, that's good.
Get on a path to find a tree of life. Yeah. And I think that's realizing, we want to share hope. We know the answer is hope. We know the author of all hope. we know our higher power at Helping Out Mission. We like to say, you know, we meet people where we're at. We talk about the higher power. In our view, the higher power that we know is Jesus Christ. Somebody else might have some other higher power they're focused on, but we're not ashamed to admit that Jesus is our higher power. And we're trying to introduce people that in a winsome way, right? Not in a forceful way, but in a way to say, okay, here's a path, here's some opportunity, here's a community. We're a bunch of broken people trying to figure out how to do this, but we're all on that journey to say, let's get and find a tree of hope. And then I realized that, you know, on the back, we have these coins. I wish I had one with me that we give to the graduates of our program. And it has a logo of Helping Out Mission. And on the back, it has a picture of a big oak tree, right? And it's based on the scripture, which is in Isaiah, but it's also in Psalm 1 about oaks of righteousness, right?
Yeah.
To be the planting and the display of the Lord. And so I realized we're actually trying to help people become, you know, oaks of righteousness planted by the Lord. That fits with the tree of life thing. I don't know. That'll preach, I think.
No, that's good. That'll
I'll
preach.
stop there.
No, Dan, that was great, man.
Yeah.
Dan, I know you well enough to know that you could have done a lot of different things. I really appreciate smart people that get in this arena because we need good minds working on this.
That's why Austin's glad I'm here.
I am. I'm glad you're here. You're just such a beautiful mind.
I mean, those glasses alone just
I
say
know.
they speak.
He got
you
him out
know,
of the bubblegum machine.
yeah.
He has to have cool looking glasses to never mind.
Yeah.
So I do appreciate you, Dan.
Yeah.
All your knowledge that you
Yeah.
bring. I do appreciate that.
Most definitely.
You know, I don't feel like I have a ton of knowledge. I'm just somebody who's been on this journey for a while, and God's given me a passion and set of experiences, and you know, it's really humbling to be a part of, you know, seeing people's lives transformed. It's heartbreaking to be a part of, you know, you know, you talked about what's life on the streets look like here. It reminds me of the C.T. Studd quote, you know, the great missionary who said, you know, some people want to live in the sound of chapel bells. I don't want to run a mission a yard from the gates of hell.
Mm-hmm.
And I always thought maybe that's a little bit of hyperbole, you know, like we're running a mission a yard from the gates of hell. And I'm not saying that Baltimore is hell. Please understand. Baltimore is a beautiful place. There's a lot of beautiful people and there's a lot of opportunity. But the crisis that we're seeing on the street with addiction, and particularly now, as I know you all see this all the time with fentanyl. And when people relapse, how many people who are relapsing are just dying?
Yeah.
And so I don't think it's hyperbole to say that in the work that you do and the we do, like if somebody doesn't come back and go into recovery and they stay out there, there's a really good chance that we could go out there again and they won't be there anymore.
Yeah.
Mm-hmm. It's life and death.
It really is.
And that is not, that's not a reality that I want to accept.
Yeah.
Yeah,
Man, I love your
Amen to
heart.
that.
I love your heart, Dan.
That is not the life, the kind of tree of life that we're trying to help people. So if we can help people understand, hey man, you may not be ready, but I'm not sure you got tomorrow. And this isn't
That's
some
true.
kind of fire and brimstone, like scare them into the kingdom thing. This is just a real deal.
Yeah.
I mean, if you look at the numbers of people that are dying right now, and we've seen, unfortunately, some of our, you know, graduates, people who have come through our program who had a lot of clean time, and they just made one really bad decision in one moment. They picked up again, and particularly because their system's cleaned out and the kind of stuff that's out there right now, they were gone.
Yep.
Yeah.
And they were gone quick.
Yeah.
And there are people.
And that
there are
breaks my
friends.
heart.
Yeah.
Yeah. Well, you know, Dan, you got me choked up too, but two things, yeah. One of the miracles that the Bible speaks about is a young boy whose mother gives him a snack, and he goes to hear Jesus speak, right? And that snack fed thousands.
Right.
What is the boy's name?
Mm-hmm.
His name is Dan. Think about it. We never nowhere in the Bible does it tell you that boy's name. When I listen to you, you remind me of that young man.
Oh, that's wonderful.
You bring the snack. You're not a Pharisee. You ain't pounding on your chest and say, "Ooh, look at me, Dan." So thank you for bringing the snack.
Thanks, Wendy.
Yeah.
Yep.
And
That's good.
fentanyl. We all know fentanyl is out there.
Geez.
Have you heard of the new drug protonitrazine? 10 to 20 times stronger than fentanyl.
Wow.
Yep. In this and it's used the exact same way.
What form? It's sort
It
of
could be
they're
liquid,
cutting
it
it
could
with
be
other.
solid.
They're doing it like they are with meth and everything. They're making the
Mixing it.
drug with that.
Yeah.
So they're giving you heroin,
Yeah.
and it's fentanyl or this
Yeah,
other thing.
protonitrazine or something like that. It is horrid. It is horrid.
I just want to say I want to thank you. That was a great word you shared with Dan. And Dan, I've got a new nickname. Snack Pack Dan.
It's gonna stick.
Hey, I
It's
like
gonna stick.
snacks. You know, I mean,
Snack pack
I
Dan.
It's
can't,
gonna stick.
I can't.
This has been
deny that.
wonderful.
like
I love
snacks.
I love your heart,
Yeah,
Dan.
yeah,
Just
yeah.
your
I like Snack Pack
sensitive-
Dan.
Yeah.
I like Snack Pack.
Thank you for the snack.
Didn't Bill
Thank you for
Cosby
the
do Jello commercials? Bill Cosby did Jello commercials.
Yeah, we don't really talk
Shouldn't-
about
we don't
Bill
talk
Cosby.
We don't really
Bill
talk
Cosby.
about
Let's
Bill.
talk about
All
Bill
right,
Thanks,
yeah,
Cosby.
all right.
Yeah.
Why did I bring that up? That was a great idea. Thank
I
you
hear you,
guys.
Austin.
Yeah.
Thank you,
appreciate
Dan.
you.
Thank you.
You're
We are
strong,
gonna-
Dan.
We were going to get out of here, but if we could, Dan, just for a second, if you could tell us a little bit about how people could get in touch with Helping Up Mission, and if they're on the East Coast, how they could volunteer. We can put your website up and stuff like that. That'll be fun.
Yeah, I mean, helpingupmission.org or helpingup.org, I think is a simpler way to get there.
Okay.
And, our phone number is 410-675-7500. There's somebody answering the phone. One of the things that we've done coming out of this pandemic and trying to help people get into our program is we created a 24/7 intake hotline. So if anybody's battling addiction, they can call 410-929-6999. And there's one of our peer recovery coaches is answering that phone 24/7, 365. We've seen a ton of calls to those lines and like about 1,200 in the first 3 months. And that was it was a brand new line. Nobody else had that number except for like on the outreach card. So it wasn't people calling to say, hey, I want to make a donation. It was people calling saying, I want help. And that's a pretty good indicator for me. And if you want to reach out to me personally, I have the longest email in the history of the organization, I think. Because I have the longest. I should just have an email like Snack Pack Dan
There you go. There you go.
Snack
at
Pack Dan.
helpingup.org. But it's D Stoltzfus, DSTOLTZFUS at helpingup.org. So that's how you can get a hold of me.
Thank you.
Sweet.
Snack Pack Dan, otherwise known as Snack Pack Dan.
Right. Maybe I'll create an email alias. So.
AKA.
Appreciate you
like
today.
that.
Thank
Yeah,
you for your
man.
time.
Love you, Dan.
Thank you.
It was great to be with you. Love what you're doing there in Dallas, Fort Worth area. And we've, learned a lot from you, particularly the sort of street outreach, mobile case management. We're trying to put that into action here.
Good.
And we're getting a lot of traction and support
Good.
on the streets. So
Good. Yeah, for anyone that wants more information about that, Metro Relief, we really want to help other cities start mobile outreaches, and we did help Baltimore start a mobile outreach. They even have a funky bus like us. So if you guys are interested in anybody, you can get a hold of me at Metro Relief, Austin at metrorelief.org. Thanks, Dan.
Thank you, Dan.
all right. Thank you.
All right, peace out.
Have a great afternoon. See you.
You too.
Good
Bye.
to be with you.
Like what you heard? Please like, comment, share, and subscribe. Our team will respond to any questions you have. This podcast depends on support from its viewers, and if you want to get directly involved, join Metro Relief as a donor or volunteer at metrorelief.org.